you in?
Sure, come on in.
Good afternoon. How are you?
Good, how are you?
I'm good. My name is Tammy. I'm going to be your student nurse today.
Okay.
All right. Can I get your name and date of birth?
It's Dina Marisi, 62574.
All right. Let me just wash my hands right quick. Ugh, stuff is hard to wash
I
it.
know. It's sticky too.
All right. Let me just check that here. Okay. Your medical record number. Yeah. Matches. And do you have any allergies to food, drugs, or latex?
No, I don't actually.
Okay.
Not that I know of.
Perfect. And right quick over here, do you happen to know where you're at today?
And the hospital.
What hospital?
Galen.
It is. Okay. Do you know what month it is?
It's almost.
And what year is it?
2021.
Good. Okay. All right. Looks good. So today the doctor has ordered a head to toe assessment. Have you had one of those done before?
Yeah, I'm sure.
I'm sure. Do you want me to explain it?
No, I'm pretty good. You're just gonna look at everything, make sure everything's okay, right?
I am.
Okay.
I am. Okay. This does take quite some time. So do you have to use the restroom?
No, I think I'm good.
Okay, all right. I'm gonna give us some privacy, so I'm gonna shut my curtain here, your curtain, all right? Now, I am gonna have to do several things where I'm exposing you, okay, and touching you. Any cultural considerations I need to take into account?
No, not really.
Sure.
I just don't like to get cold.
Okay, well, we'll make sure, I see your covers are off, so we'll make sure that we keep you covered and only expose the parts that I need to see at that moment.
Yeah, I get hot and cold sometimes.
Okay, well, we can take them on, off, up to you, whatever makes you most comfortable. Okay? All right. So we're gonna keep you setting up like this for now.
Okay.
All right? When it comes to a certain time, I'm gonna have you lay back. If for any reason you're not able to do that, please let me know, and we'll make other accommodations.
Okay,
Okay?
sounds good.
All right. So there is not even gloves in this room. I do not want you guys stating I'm gonna put on gloves. You guys are actually gonna use gloves. I am because I'm not accessible to gloves right now. Okay? So I'm gonna start right at your head. Okay, like I said, a head to toe assessment. So I'm gonna start right up here and I'm just gonna go down. Okay?
Okay.
So I'm gonna put on a pair of gloves. Anytime we're in the hair, we're gonna use gloves. So I'm gonna check around. We're gonna be feeling, okay? Size, shape, symmetry, okay? No lacerations, no lumps, okay? No infestations, no lice, okay? Symmetrical. All right, so now take it off. Okay, I also noted that I did not see any breakdown in the back of the head. Okay, take off my gloves, wash my hands. Like I said, this is nurse specific as far as if you want to reapply gloves. If you want to reapply gloves, you would still take it off, wash hands, reapply. Could you take off your glasses for me? Thank you. I am just going to be palpating on your face. Okay? Sinuses. If you feel any discomfort, please let me know. Okay? So.
No.
Okay, how about here?
No.
Okay. Nothing?
No, feels good.
Okay. Have you had anything going on around this area at all?
I always have a little congestion, but it didn't hurt me to touch it.
Okay. Alright. I'm gonna take a look in your ears.
Okay.
Alright. Alright, no excessive cerumen noted. No unusual drainage, no redness, no swelling, no sores. Okay, I'm gonna take a look at the back of them. No sores noted there. Any pain or anything while I'm touching?
No.
Any tenderness, okay?
No.
I would do the same to the other side, noting that there's no excessive cerumen, okay? No redness, no drainage. Same thing with the back of the ear, okay? All right, same thing with the nose. Nose, there is septum is midline, no deviation. There's no unusual drainage, no sores, no lesions. Okay, all looks good. Any trouble breathing out of your nose? Okay.
No.
Next thing is the mouth. Okay, just open up for me. Okay, looking in there, it's moist, it's pink, no sores, Your teeth are mentors? No. Okay, well, you would ask your patient that, okay? I'm sorry, but you have to ask your patient that,
No, I
okay?
don't have dentures.
Oh, I'm like, oof, well, sorry, but you have to ask your patient that. Okay.
They're really that straight.
Well, it's a question that these guys need to know to ask.
I'm sorry.
Okay, so, no dental caries notice, anything like that, okay? Okay.
I'm sorry.
Okay. She said that. All right, so now I'm going to have you look straight ahead.
Okay.
All right, I'm gonna dim the lights. Okay, just look straight ahead. I'm just gonna take a look at your eyes, okay?
Mhm.
This is where you're really not gonna see a whole lot unless you have the dimmed, okay? All right, so now I'm gonna turn the lights back on. I'm gonna have you look at my pen light, okay? I want you to follow the pen light as it's coming in with your eyes. Okay, good. All right, so pupils were equal and round, and they, I just lost what I was gonna say, accommodated, okay, to the object, all right? Inward motion, okay? All right, so we did that with the eyes. Pupils were equal, round, reactive, and then combination, okay? Now, we are going to start, I'm gonna do the carotid. Remember, when you guys do the carotid, make sure you state that you're only gonna do one at a time, okay? They need to know that you know why, okay? Why do we only do one at a time? Yes, if you do both at the same time, you're gonna occlude that blood that's going up, and the patient's going to pass out, okay? So I'm gonna state that I'm going to feel, okay, 1, and then 2, and I'm gonna state that it's strong, okay? Equal, both sides, okay? Then we can state that we're gonna do, for me, I would say I'm gonna do the lymph nodes. So I would state that I'm gonna do the preauricular, the postauricular, the occipital, okay? The submandibular, the submental, the deep cervical chain, okay? The supraclavicular is right up here. The superficial cervical is right behind there. I would go ahead and do the arms as I'm here. So I would say lift up your arms. You're gonna do the lateral over in here, the central, axillary down the middle, the pectoral is back here, the epitrochlear is here, I'm sorry, the pectoral is here, the clavicular is here, subscapular is here. So I would get those out of the way, and you could say you would do the same on the other side. You don't have to do both sides. Just state that you would do the same on the other side, okay? It's up to you how you do your lymph nodes, okay? I just think it makes most sense to do here and then do here, okay? All right, so I did those, okay? Again, if you're gonna be doing, you know, lymph nodes and that, you probably want to use gloves, okay? So we did that. I'm gonna go ahead and I'm just gonna keep moving down. As I'm doing that, I'm assessing, you know, she's open here, so I would be assessing her skin as I'm going down. You know, I'm touching her, so I'm noting that she's warm to touch. Okay, I don't see any marks, okay, any lesions. I can go ahead, I can pinch here. She's got rapid recoil, okay? I can go ahead and look down her arms. I can go ahead and do each one, okay? Say less than 2 seconds. All right, cap refill is good. All right, you can do skin trigger somewhere else if you want to, okay? Rapid recoil, no problems. I can just look to see if she's got any swelling, anything like that. Nothing going on. I can go ahead and ask her, can you bend your arm? Okay, no crepitus, nothing like that noted. Any pain while I'm doing that?
Okay.
Okay. How about with this arm?
Okay.
Okay, can you squeeze my hands? Squeeze it like you mean it. Oh my lord. Okay. All right. Equal strength. Okay? No problem. All right. So, Now that I'm to this side, I made sure I checked out her arms, everything looks good with her arms, got strength, good strength bilaterally, she's got good movement, no crepitus. I'd go ahead and take a listen, okay? Again, this is not something you guys are gonna say, I want stethoscopes brought with you guys. I know I'm not a great example, not having mine right now. Have your stethoscopes. Yes, you have to put them on, yes, you have to use them, okay? So, I'm gonna let her know that I'm going to listen to her breath sounds. There is absolutely no listening to breath sounds over the gowns, okay? This is the point that I would tell her, I'm going to expose her from here to here, okay? This is where I would take the blanket, all right, and move it up to here, okay? So, I'm gonna go ahead and cover you for now, okay? With your nice little blanket. All right, and I am gonna have to expose your chest so we can listen to some breath sounds, okay? We don't wanna hear that rustling and that, so we're gonna do this, take this down, okay? So, we're gonna start up here and we're gonna go tracheal, tracheal, bronchial, bronchial, bronchial vesicular, bronchial vesicular, bronchial vesicular, bronchial vesicular. We're gonna say vesicular, 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 vesicular. Okay? And I'm sorry, when you do that, when you start, say every time you feel my stethoscope touch your chest, take a breath. Okay? So, I'm gonna say clear lung sounds throughout, no adventitious sounds noted. Okay? From there, I'm gonna go ahead and listen to heart sounds, because I already have her in this position. I already have her right here right at the front. Okay? So, I'm gonna go ahead and do my heart sounds. Alright, so right side, I'm gonna feel for the clavicle, okay? I'm gonna go down to the second intercostal space, right at the sternal border, my aortic, okay? I'm gonna move right over to the left second intercostal space, left of the sternal border, my pulmonic, okay? Move down one to the third, okay? Left of the sternal border is gonna be my my Erb's point, sorry. One more down. Okay, my fourth intercostal space is my tricuspid, okay? And then down to the fifth, all right, is gonna be your mitral, okay? When you wanna go mid-clavicular, okay, which usually for women is gonna be right up underneath there, okay? So if you go mid-clavicular, all right, you're gonna palpate first. Okay, so you're gonna palpate, you're gonna state that I'm gonna palpate, all right? Then you're gonna put your stethoscope there, you're gonna turn it over to the valve. All right, you're gonna listen for 1 full minute. No, you're not gonna listen for 1 full minute, you're gonna state it, okay? I would state I'd listen for 1 full minute, no murmurs, no gallops noted, okay? Regular, okay? So, we did that, okay, how are you doing so far?
Okay.
Okay, any pain?
No.
Okay, how about if I asked you on a scale of 0 to 10?
0.
Okay, if at any time that we're going through this, you start having pain, please let me know.
Okay.
Okay? I'm just thinking. They don't. But the, for the landmarks, the thyroid, it's not that you really have to assess it, it's the landmark. So the thyroid, you would just, the general area thyroid, the, what is it? Thyroid. Suprasternal notch, the angle of Louis, okay? That would be, sorry, before your lung sound. So your thyroid, your suprasternal notch, and your angle of Louis, and your costal angle, okay? Costal angle, guys, is the same as your ribs, okay? You're just basically outlining the mannequin's ribs, okay? So I'm gonna put it here, and I'm gonna say, take a deep breath. Okay, you see how my thumbs come apart? Okay, they go back together. All right, less than 90, that's what we want, okay? You can do it on the back as well, all right? So, prior to doing lung sounds, that's what you can do. You can locate trachea, suprasternal notch, angle of Louis, costal angle. Okay? Alright, so we did lung sounds, heart sounds, okay? We have our locations down, It's up to you what you wanna do from there. Do you want us to help you lift the patient up and do heart sounds and lung sounds, okay? Or do you wanna still continue to do the front, okay? We're gonna go ahead right now and just do the front, okay? So, are you okay to lay back?
Sure am.
Okay. I am going to lay you back. If at any time it bothers you, please let me know.
Okay.
Remember, abdominal assessment must be flat. Okay? Huh? Oh,
You're fine. You're all set.
so, reason being for the patient laying down is we are going to bend down, we're gonna look across the abdomen. We're wanting to make sure that we don't see any distension, okay, anything abnormal. Do we see like a pulsation going on, okay? If we see a pulsation, we're gonna think AAA, which is an aortic aneurysm, okay? We see something like that, we wanna stop immediately. Why? Because if you go and do something like this, it's an aneurysm, think about an aneurysm. You hear about aneurysms all the time. What do aneurysms do? Right. So, I go and do something like this, wow, it's pulsating, you know, I go do that, okay, she's gonna bleed internally, okay? Stop right there, call the doctor, okay, and make sure nobody else touches your patient, okay? So call the doctor, alright, so I'm looking, I don't see anything. Remember, abdominal assessment, look, listen, feel. Always that order, look, listen, feel, okay? So I looked, okay, now I'm going to listen, okay? Your book does state, when you listen, the best way to listen is the right lower quadrant first, because it states that if you're gonna hear vowel sounds, most likely, it's going to be first heard in the right lower quadrant, okay? You will not be marked off if you start somewhere else, okay, I'm just telling you that. But that is what your book states, okay? So, you do have to state you're gonna listen for 1 full minute in each quadrant. So, right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, I would listen for 1 full minute. Now, the question may be asked to you guys, so you need to know. What would I do if I didn't hear anything after 1 minute in each quadrant? What's the next step?
Listen for 5. Listen for 5.
Listen for 5 minutes. I can guarantee you an instructor is going to ask you, okay? You would listen for 5 full minutes. What would be the next step if you didn't hear anything? What would you guys do?
Ask another nurse to listen.
Thank you, yes, absolutely. Don't jump right up and call the doctor. We all know that if it's unexpected, okay, if your patient has always had bowel sounds, you go in there and suddenly you're not hearing any, you know, they could have an obstruction, there's all sorts of bad things that could be going on, okay? It's not good. However, before you go call the doctor, listen for 1, then 5, get a partner, have them listen. Still don't hear any, call the doctor, okay? You may be asked that during CPE, it's fair game, okay? So make sure you understand that and know that, okay? So, my patient had active vowel sounds in all 4 quadrants, okay? No problems at all, okay? Palpation. So, I'm gonna palpate, doesn't matter where you start, okay? So I got the hypochondriac, where am I on the right? Right hypochondriac, epigastric. Oh, let me know if you have any pain as I'm going along, and I'm doing light palpation because we do not do what? Thank you. Left hypochondriac. Okay, I'm gonna come right back over to where I am, okay? I have the right lumbar, I have the umbilicus, I have the left lumbar, I think what's that one? I have the right iliac, I have the epigastric, and I have the left iliac, the hypogastric, sorry, hypo, my bad. The left, my patient talks too much, I am sorry. I know, she's got good intentions. So no, we should know that. Okay, so make sure you got that right. Alright, so, no pain,
No
no
pain.
tenderness,
No
okay. So, again, patient noted no pain, okay, on light palpation, okay? So remember what you're saying, okay, all of this stuff that I'm saying, this is the kind of stuff that's gonna go into your documentation. Okay, these are my findings, okay? This is what I'm doing on my patient, I'm doing a head to toe assessment. These are my findings. She had no pain in 9 regions, okay? You don't have to name the 9 regions, just no pain in 9 regions, okay? Now, when was the last time you urinated?
Couple hours ago.
Okay, now, what was the color?
Yellow.
You guys could've told me there was gloves right there. Hogging the gloves and not telling me. It was yellow? Okay. Was there any unusual odor to it?
No, not like pee to me.
Okay, but was it your normal smelling pee?
Not like that medicine they're giving me.
Well, what medicine is that?
Some they're giving me through the IV.
Oh, okay, well, I'll have to look at that and see what it is. What about any particulate, anything floating in it, anything like that?
No.
Okay.
Other than I poop.
Okay, well, we're getting to that
That's
next.
when they get the floaters.
Okay, well, we're getting to that next, okay? Alright, so what about poop?
Yeah, what about?
What, any unusual smells other than your smell?
No, I go every day though.
Every day?
It's like clockwork, 10 o'clock,
You know
every
what,
day.
a lot of people don't have that, so that's good. Alright,
Comes right out.
okay, but how does it come out? Is it like formed, is it loose?
It's formed.
Good. What
Yeah, I sit down, it's brown.
Brown, okay, that's what we wanna
You
see.
know, you nurses are weird. You always wanna know all that stuff.
Listen, your color of poop can tell lots,
Yeah.
okay? It can tell us lots. This is why we ask the color of poop, okay? Some patients may say, oh my God, my poop is black, okay? And then we ask them, what are you taking? I take iron every day. Do ya? Because guess what? Iron turns it black, okay? Alright, so I'm gonna push on your bladder a little bit,
Okay.
okay? If she's telling me, well, she pooped a couple hours ago, but if somebody tells you they just went to the bathroom, you shouldn't be able to feel anything, okay? So we're just gonna see if it's tender at all, okay? Okay, alright, perfect. Alright, so now I'm gonna cover you up a little bit right here, okay?
Okay.
Now we're gonna look at your legs, if that's okay?
Okay.
Alright.
I may have to shave.
Well, you know what, that's what everybody says in the hospital, but that's okay, alright? So, at this point, I just felt your bladder, so I can hold off on changing, because I'm just gonna say upper and lower lymph nodes. No swelling noted, no pain,
Okay.
okay? Femoral pulses, strong, okay, they're fine. At this point, this is when I would take off my gloves, okay? Put them in the garbage. Wash my hands, alright, if you want more gloves on, more power to you, okay? So now I'm just checking out her legs, okay? Obviously on the mannequin, you're gonna be able to see everything, okay? I'm just feeling, okay? Yeah, I'm just feeling. Any pain, tenderness?
Okay.
Alright, perfect. Remember, we're feeling. Wanna make sure there's no DVTs there, okay? We're looking here for swelling. Usually with the swelling and stuff, you know, we're wanting to push in this area. Okay, push around in here, okay? That's what we're gonna wanna know about the swelling, okay? I can go ahead, since I'm right here, and say I'm gonna check, okay? My posterior tibialis, okay? My pedal, okay? And guys, I'll tell you when you're doing it on a real person, we may tell you the pedal's right here, but with each patient you do, pedal's gonna be in a different spot, okay? Alright, so those are the only ones you guys have to do down here. So keep, you know, just like I said, feel the legs, make sure you look at them. Like I said, you're wanting to note swelling, anything unusual, the color, why? Because maybe somebody has PVD, something like that, okay, PAD. Alright, so I'm gonna go ahead, I'm gonna bend your knee, okay, any pain?
No.
Okay, go ahead and do it one more time. I'm gonna feel her knee, I don't feel any crevice, anything like that. I'm gonna do that one more time. Okay, same. Can you go ahead and push on my hands? Okay. Strong, fine. Push up. Okay. It's strong, okay. I would go ahead, you know, your patients, your mannequins don't have any socks on at this time. I would look, make sure there's no breakdown on the feet. You can also look when you turn your patient over. That's when you would be able to see the heels of their feet and that. Okay, we already checked pulses. We already did all of that. Made sure that everything was intact there. Pulses were good. We checked the crepitus. Okay, now I'm gonna have you, if you can, close your eyes. Okay, can you tell me where I'm touching?
Left leg,
All right, how about now?
right toe,
Okay, how about now?
right arm,
Good. All right, how about now?
left arm.
All right, so her sensation's intact. She knew exactly where I was touching. All right. Now I'm gonna have you, I'm gonna take these off for now. Sorry. Are you able to roll over?
Yep.
And this little stone that way, so they can all see. Okay, while she's rolled this way, there's a needle in the bed. That nurse prior to me is hitting it right up.
No, really, there's something under here too.
Seriously, we find this stuff all the time in the hospital.
It's a wound.
Lord. Okay, so while your patient's in this position, this is where you're going to say, again, I'm gonna look at the back of the head. Remember, breakdown can happen here. Just, this is how the ears get broken down too. I'm gonna look all the way down, okay? In this area, this is where we call that sacral edema, okay? It looks like a pouch almost, okay? It's like a pouch, all right? We're gonna look down here at the coccyx area, make sure there's no breakdown there, okay? We're gonna go all the way down. No hemorrhoids, no bleeding, nothing like that, okay? No unusual drainage. Again, the heels can be seen here, so we're just looking all the way down. At this point, since she's right here, you can either do it here, or you can do it when she's sitting at the side of the bed to do the walking, okay? I can go ahead and do it here and say, while you're laying on your side, I'm gonna go ahead and listen to your lungs, okay? All right, the only thing is she, laying on her side like this, the problem you would have with the person, she may not be able to expand real good, okay? So, I'm gonna show you guys sitting up at the side of the bed, okay? Because like I said, with her laying like this, now if your patient is really unable to sit up at the side of the bed, or kind of sit up straight, you may have to do it like this. But with her laying like this, it may be hard for her to actually take a deep breath and give you the breath that she needs. All right, you can roll back over. Make sure if you have your patient do this and they are on an ER stretcher, that you're standing next to them. All right, how do you feel?
Okay.
Okay. All right, I am going to put this up, and I'm gonna lower the bed some, so you can sit up. We have a couple more lung things to do with you.
Okay.
Lung test.
The middle one.
Woohoo! You're going like, I gotta even you out.
You just push the middle one and hold it down. It should go down.
That's what I do.
It's broke.
Hold on, we're getting it, and I'm even you out again. Well, we'll get it by just doing this back and forth.
It's all good. That's even.
Huh? That's even. This one?
Oh no, I'm saying the bed's even now.
Oh, yeah, it's even. That pumps it up. Yeah, and I did do the middle one though, didn't I? And it lowers her head.
Yeah.
Oh, this is too much. Okay, that should be good.
Sad thing is a lot of hospitals will have these kinds of.
Right? I know. Isn't that terrible?
Pull up and there you go. And mix it up.
Sure. Are you even? You feel even? Are you close enough? Well, I'll have you, I don't care if you're close enough to the ground so much, because I'll show them the reflexes from here, because I don't want your legs totally touching the ground for the reflexes. Yeah, sorry. Are you okay to sit up?
I'm okay.
Because before you sit up, I was gonna check your respiratory, forgot. Your pulse, okay? So her pulse laying down, she was 74, okay, regular. Now I'm gonna check it setting up. Are you having any dizziness, anything like that? Okay. Okay, it's still 74, she's fine. Anything now that you're sitting up?
No, I'm good.
No? 74 regular.
My hair would feel.
Okay. Before you do anything, I'm just gonna go ahead and check your reflexes. So I'm
Okay.
just gonna check your quadriceps reflex. So I have my hammer, okay? I'm just gonna pop it there. Oh yeah, great reflex. Perfect. Okay, just gonna check your Achilles. Oh my goodness. Okay. All right. I'm gonna go ahead and do these ones up here. So brachial here. Alright, I'm going to do your triceps. You guys all seen that, right? Okay. Your brachioradialis. Okay. Alright. Got all of those. We're good. Did those.
And they have to say we would do it on both sides, right?
Yeah, oh, I'm sorry. Yeah, make sure you state. You don't have to do it on both sides. Just make sure you state. I would do both sides. Okay? Alright. Now, what I'm going to do is I'm going to try and move your butt out a little bit. If I can squeeze myself through here. Just so I can come behind you so they can kind of see. Alright, so at this point, this is where I would say I am listening to her lung sounds. Okay, there we go. Alright, so come behind her. Like I said, we kind of want to outline, okay, the scapula's here. Don't want to go over bone. Okay, so we would just say bronchial, bronchial, okay, bronchiofascicular, 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 bronchiofascicular. Then you can just go vesicular, 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 okay? Now, with the testing, okay, tactile fremitus, you can go with the heels of your hands. Every time you feel me touch you, say 99.
99, 99.
I'm so close, I
99.
can't
99.
get my hands all the way
99.
down, sorry.
Do they do that in the front too? Because the book has them do it.
No, just do it in the back.
Okay.
Okay, I did see that, but they just have to do it in the back, okay? Just the back, even though the book shows the front, just the back. Now I'm gonna do the same thing, but with the stethoscope, okay? I want you to say 99, this is our bronchopathy, okay? Every time you feel my stethoscope touch, say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, good. Now every time I touch your back with the stethoscope, say E, this is gonna be for egophony.
E, 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 E.
Okay. Now, last one is pectorally, and that's going to be the whisper test. So you're going to whisper 1, 2, 3 every time you see me touch, or every time you feel me touch the stethoscope on your back. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay. All right. So we listened to your lung sounds. We did your tactile fremitus in that. This is where you would have the patient not do that. Not let the patient escape. All right. Okay. Now.
Are you doing like that?
Yeah.
What about that?
No. No, they have to do every other. Yeah, she's just asking questions. Sometimes there's stuff in your book, but you guys aren't expected to do per se. Okay. All right. There we go. That worked. What do you know? I guess if you're laying on it, it maybe makes it go down. So this is where one more time I would check before she gets up. Now, before your patient goes to stand up, make sure and ask your patient, because maybe you don't know yet, maybe you haven't heard a report or whatever. Do you need any equipment getting out of bed, or are you okay on your feet?
I'm pretty good on my feet.
Okay. Do you mind standing up? Sure. Okay. I'm just going to, if you can, walk 5 steps away from me. And then 5 steps back. I'm just looking at her gait, making sure she's nice and steady, which I can see that she is, okay? Can you just kind of touch your knees for me? I'm gonna take a look at her back and see that it's aligned, there's no scoliosis noted. And if you can just stand up for me. Okay, I'm just gonna look from the side, make sure there's no lordosis, okay, kyphosis, yeah. Oh, she has lordosis.
That's what I mean.
Alright, so she has lordosis, we noted that, okay? Alright, so that's what we're trying to note in there, okay? You guys could either do one range of motion at this point, or you can tell me that you did it in the bed, okay? I don't expect you, I know you guys have like a huge page of range of motion in your book. No, you don't have to do all those. Okay, I seriously had a girl go through like every range of motion that there was. Poor thing, okay? No. Okay, just one thing. How are you feeling?
Good.
Okay, all right, sit back down for me. No. Some of them do it during their cranial nerves. I had students doing it today. I just had to remind them eyes have to be closed. If anybody does the Romberg's test for their cranial nerves, make sure that when you have the patient stand there and you put your arms like this, that the patient actually closes their eyes. Because that's the purpose of the Romberg's test, is them closing their eyes to see if they're gonna sway once the eyes are closed, okay? So remember, Romberg's test is the patient standing here, I'll show them. Patient standing like this, your arms here for protection, tell them to close their eyes, all right? If she was to start swaying off balance, that's a positive Romberg's test. Okay, so something's going on.
Yeah, their feet have to be together.
Yep.
Arms by their side and eyes shut.
All right. All right, sit down. Now, would you rather, oh, you know what? Did anybody notice something that was not asked?
Socks.
So, guys, must have socks on, okay? She did have socks on. I think that's what threw me off. She did have socks on. They will be in the bedside table. When you guys are testing, they'll be in the bedside table. You don't have to physically have them on the mannequin. Just pull them out of the bedside table, lay them over the mannequin's feet, okay? We as instructors will be the patient when it's time to do the walking. So just like she did, we will sit on the side of the bed. We will do what you want us to do. But the mannequin, you just have to put these socks over the mannequin's feet, okay? That's all you have to do. All right, so are you comfortable like this, or do you wanna lay down?
Are you leaving me now?
Well, yeah, your lunch is coming.
Oh.
Are you sure? You know, we're fine. All right, well. Ma'am, it's for your good.
I know.
Okay.
You've been so good to
Oh, thank you. You know what, I try my hardest. All right, I just had a Daisy award last week.
me. You did. Good for you.
I
You go
did.
girl.
I know. I worked so hard for it all year. Finally, somebody noticed. So, here's your call light, okay?
Thank you.
Don't call, but here it is. Right here next to you, okay? You got water?
Yep.
Ice?
Yep.
Pepsi? Okay? You're good? All right? I will see you in an hour. All right? For my hourly rounding. That's what you guys are supposed to say, hourly rounding. You're not supposed to use the verbiage, I'll be back to check on you. Okay? Remember that. Yeah. That's what I was taught at the hospital. And the 6 Ps. Pain, potty, periphery.
Pain, potty, personal belongings, position,
Plan.
all that. We were taught that.
We were told to go in there and ask it every hour.
Well, the reason is they've actually done these scientific studies that show they don't call the call bell as much.
But not only that, these are things that are on the
HCAP.
age caps. So they figured that if you're asking these things every hour that you go in, it sticks in the patient's head. So when they see it on the age caps, they're like, oh yeah, they did that. Yeah, oh yeah, they did that.
And
We asked about pain, we asked about potty, we asked about, their belongings. So they answer yeah, because the only thing that counts on age caps is always. If they mark anything else, nothing. Okay?
I found that if I tell my patients that, we'll be back on our rounding, but I'll probably be back before that to check on you, they just feel more comfortable, and they even use the call bell even less, and if you follow up on it, and they know you're coming, and then you actually do come in, and then they'll just wait for you, and if you do come in, like every 30 minutes, but you kinda get a routine where you just round your rooms, they don't really bother you that much. Unless they really, and when they do call you, they really need something, so I better get there right now. And they'll learn you, it works.
Any questions, concerns? Now you see you all.
If you find this in someone's bottom, it's not a good thing.
God, it smells like complete alcohol or something there.
Yeah.
You know what?